Welcome to the program. I'm your host, Neal Howard, here on Health Professional Radio. Glad that you could join us today. Our guest is Dr. Rana Awdish, Director of the Pulmonary Hypertension Program and Critical Care Medicine at Henry Ford Hospital, located in Detroit, Michigan. And she's joining us here on the program today to discuss her own near-death experience, an experience that transformed her approach to medical care. She's also won the prestigious award of the National Compassionate Caregiver of the Year from the Schwartz Center for Compassionate Care. And in addition, she's an author, the author of a book entitled In Shock, My Journey from Death to Recovery and the Redemptive Power of Hope. Welcome to the program, Dr. Awdish. How are you?
I'm well. Thank you for having me.
Okay, near-death experience. Our listeners and myself, we're getting this visual of, the classic near-death experience that many of us have not ever experienced, only through television and other people's accounts. So I don't believe I've ever interviewed anyone who's had a near-death experience. So this is a fascinating first for me. Tell us a bit about your medical background, and then let's talk about this near-death experience that changed the way that you practice.
Sure. I'm a critical care physician, as you mentioned, and I had just completed the final day of my fellowship training at Henry Ford Hospital, and I was 7 months pregnant. I, like a good physician, was trying to time my pregnancy so that it wouldn't interfere with my training. And I had sudden onset of abdominal pain. It felt very high, sort of in the area of my stomach. I wasn't as worried about the baby, but that something was very wrong with me. And what that pain was a tumor in my liver that burst open. And it was an arterial bleed, so that kind of gush that's very fast and powered by the heart. And so in the space of about 2 hours, I went from sitting at a restaurant at dinner to being in an room in multi-system organ failure. And really what I remember as I was losing consciousness was that, I could hear the anesthesiologist say, "We're losing her." And I thought to myself, you better pay attention to what's happening here. This sounds bad. This sounds serious. And I tried to alert myself to survey the room. I knew that I had lost all of my blood volume into my abdomen. I had heard my labs repeated. I knew my hemoglobin was 3 and I didn't have clotting factors. I knew my liver was failing and my kidneys were failing, and I was rapidly becoming unable to breathe. And when I tried to look at the room, I realized that I could see the whole room and, in fact, could see myself on the table, as well as the doctors who were working to extract the baby and the anesthesiologists who were working to place central line access. And I thought, you know what? They're right. They are losing me. If I can see myself, I think I might already be lost. And, in that moment, and certainly I was not someone who believed in any sort of near-death experiences that had been articulated by my patients. I studied neurosciences, and I thought it was just a faulty wiring of the brain that was anoxic. And then I had that experience, that everyone talks about, where I felt really small and weightless and yet expansive, as if I were part of everything and able to observe, but yet completely impartial. I didn't feel attached to what I was watching, even though it was my own death.
You say you weren't connected, so you were totally indifferent. Yeah. So there was no panic, there was no fear. I can't imagine. Were you okay with what was happening to you?
I went into the hospital in horrific pain from that ruptured tumor that was reorganizing my abdomen. And what I remembered in that moment, and what I so desperately wanted to tell my husband when I woke from the coma, was not only was the pain gone, but I felt completely at peace. Just the most peaceful feeling I had ever felt in my life, despite everything that was still happening. And the first thing I told him was, there's nothing to be afraid of.
Did you remember coming back to your body, or you just saw the whole room, you saw yourself, and you saw these physicians working to bring you back? Did you go back into your body and then wake from the coma? How did that transition take place in your mind as you remember it?
Yeah. So what I remember was knowing that I had to make a choice, that in that moment of complete peace and absence of pain, that I had to decide to either go back to the pain, and if I went back to the pain, I could go back to all the rest of it, or to leave the pain, but understanding that if I made that choice, I was leaving everything as well. And while I vividly remember being aware of the choice, I don't remember making the choice. The next thing I remembered was waking up in the ICU to my childhood priest who was doing a sign of the cross on my body.
When you were hearing we're losing her, could you sense how they were feeling? Was this an unknown hospital to you, or were these people that you worked with?
Yeah, this was very much my hospital. It was the hospital I had very specifically targeted when I knew that I was in extreme danger. We have a remarkable level 1 trauma center, and I truly believed that, they could save my life. The mood in the room was panic, a controlled chaos, as anyone who's been in that operating room environment knows, that things were moving really quickly and people were trying to rally each other, understanding that seconds were crucial.
You being a physician, coming out of this experience that, as you describe it, I'm trying to get a visual and, putting myself in that position. But as a result of that, you've changed the entire way that you approach medicine.
Yeah. I was in love with medicine from the time I was 5 years old. It was everything to me. A pediatrician had saved my brother's life when he was an infant. He had epiglottitis, and that physician made the diagnosis so gracefully. It really struck me as the most beautiful job description I could imagine, that you could listen to symptoms, transform them through your knowledge, and see more clearly, see what the diagnosis and the cure could be. And I viewed medicine really as aspirational, as science embodied in humanity. I couldn't have loved anything more. But my orientation was always to the diseases. It was truly the diseases that I loved. And the people that were burdened by the diseases weren't something that we learned about in school. It wasn't how we talked about things. We talked about diseases and treatments and diagnoses, and the people were sort of these places the diseases would land to us, but not people. And so what surprised me when I became sick was how different what I needed from my care team was than what I myself had been giving my patients. I thought that by providing the best possible medical care, I was alleviating their suffering. I didn't know that relationship, that bond that forms between physicians and their patients, that itself, that caring, is a healing space, and that you can't bypass that. You can't bypass the suffering and just get to the science and the medicine, that you have to spend time in those hard spaces.
Now, I understand that in addition to being an author, you also developed a program called Clear Conversations. What is this program all about, and how has it become an extension or an indication of your transformed approach to medicine?
Yes. So what I think I realized when I was a patient was that my physicians were struggling to have difficult conversations with me, their patient, in the same way I had struggled to deliver bad news when I was just a physician. And that our training really isn't designed to allow us to serve our patients in that way, to give our patients the kinds of conversations that they need and deserve to have. So what we developed with a group of us, an educator, a palliative care physician, a critical care physician, is called Clear Conversations. So CLEAR stands for connect, listen, empathize, align, and respect. And those are really the guiding values that we've chosen to embody all of the training. So we use really skilled improvisational actors to act out scenarios with our patients. So they act as the patient and the physician gets to role play. And they're given tools to have these conversations in a way that they wouldn't have had before. No one taught us how to tell somebody that they have cancer. That wasn't something we learned. And yet we're thrown in to do it almost on day one with really no evidence supporting the best way to do it. So what we saw was the need to really buttress our physicians with the skills and the roadmaps for these conversations, just like we would train them to do an operation. You know, you break it down into manageable chunks and you let them practice on a low-risk situation with an actor before throwing them in with a patient.
Has it been successful in your opinion and achieved exactly what you thought it would or what you wanted it to?
You know, once we realized that the training was producing, a product that wasn't well qualified to do its role, we had to change the training, and it has surpassed our expectations. Not only has the communication with our patients improved, but truly physicians' engagement with the work has improved. So feeling that their purpose is restored, feeling joy in work, those things that are so intangible but are part of our national conversation right now around burnout and attrition and even physician suicide. Those are the things that I think this kind of program can address, and it's been really brilliant.
Your book, In Shock, My Journey from Death to Recovery and the Redemptive Power of Hope. Why did you write the book, and where can we get a copy online?
So it's available in Amazon and Barnes & Noble. Thank you for asking. And really what made me write it was I realized that as a physician, I had, a voice, I had agency, I had some knowledge of the healthcare system, and yet I still felt that I'd been failed in many ways. And if I had that agency and that voice, I had an obligation to fix it for patients who didn't have any of those things. I'm empowered in that sense to do that for people who are voiceless. And so I felt it was my obligation.
Have you encountered many patients since your near-death experience who have experienced the exact same thing and can relate to you and you to them? And have you been able to help them through their experience?
As my orientation changed and the way I talk about it with my medical students and residents now is that I realize that what my patients need from me is to basically be a Sherpa. I need to walk alongside them. It's their path. It's their goal. They've set it for themselves. I know the pitfalls. I know the traps. I've walked that road before. I can advise them. I can guide them. I can carry the load when it gets heavy. But I'm there to partner with them. And that shift in orientation has been everything, both for me and I think for my patients who truly feel that they have someone, to shoulder some of the heaviness and light the way.
It's been an absolute pleasure. Thank you so much for sharing with us today. Some great information, and I'm hoping to get a copy of your book as soon as I can. And once again, thank you for joining us here on the program today, Dr. Rana Awdish.
Thank you for having me, Neal.
You've been listening to Health Professional Radio. I'm your host, Neal Howard. Transcripts and audio of the program are available at healthprofessionalradio.com.au and also at hpr.fm. You can subscribe to this podcast on iTunes, listen in, and download at SoundCloud. And be sure and visit our affiliates page at hpr.fm and healthprofessionalradio.com.au.